Well, turning to long-term care homes now, nearly 60% in Ontario are struggling with COVID outbreaks. Some 2,500 residents are infected. When it comes to staff, that number jumps to 4,000. Earlier tonight, I talked with Dr. Samir Sinha. He is the Director of Geriatrics at Sinha Health and University Health Network in Toronto.
When you hear these numbers, your heart sinks because when you realize that with nearly 60% of our homes in outbreak, that translates into not only 2,500 residents who are sick, but 4,000 staff who have to isolate at home for up to 10 days. That means 40,000 staff days that can't be easily replaced. And when those staff can't easily be replaced, that means that there's just care that's just not being provided. And so what really concerns many of us right now is that we just know that a number of residents are not getting their care needs met to the way they need to. And certainly while we've seen vaccinations really stem the level of death that we've seen before, and that's great, we know that a number of residents are not being fed or hydrated to the standard that needs to occur, and that even people are going without bathing and getting dressed properly. It's just a really awful time to be a resident in a long-term care home. And the best thing we can do right now is just try to see where we can fill in staffing gaps. And I don't know if we've actually done all we can on that front by, for example, getting the Canadian Red Cross involved, where they volunteered and are willing and standing by to help out, or even the military. Because right now, I think, too many homes are struggling with enormous staffing crises. And we know that residents, at the end of the day, many who are living with dementia cannot advocate for themselves or suffering in silence. And this is just something that's absolutely gut-wrenching for families who just feel torn and they just don't know what they can do.
Well, all of this comes as a draft on new national long-term care standards are set to be released this week. Dr. Sinha says 18,000 people have contributed to those standards. They're hoping to get thousands more to comment on what they've come up with so far.